Blue Cross and Blue Shield of South Carolina, we are coming after you. Today we're going to talk about this insurance giant and how it shapes the healthcare landscape of South Carolina. I'm Dr. Hatemi with Veritas Urgent Care Group, and I'm with Eric Corcoran. Hi, Eric. How are you doing?
Oh, it's great to be here with you, Dr. Lachin. And, you know, we've done this before, but not on this subject. But I'm just so proud to be back here in Lexington talking about really important things.
True. We talk about very important subjects about healthcare. Everybody talks about insurance, access to healthcare. Mm-hmm. These are very important topics, so we're going to talk about it.
Yeah. Well, let's start at the beginning, which I think is the most important place to be. Starting out getting into healthcare. Tell us a little bit about your journey to being where you are today.
So I'm a doctor. I got trained in Lexington, Kentucky. Actually, I'm from Kentucky. I'm a transplant in South Carolina. And I decided at one point to open urgent care, and I picked Lexington, South Carolina as the destination. I bought a building in Lexington, and I opened my doors, and that's when my journey in Lexington started as an urgent care owner. And a few months after I purchased the clinic, COVID pandemic came, and it changed the whole story.
Absolutely. And coming from Turkey to the United States, I mean, I'm an immigrant from Ireland, as you know, proud legally, went through the system and got sworn in 2016. Tell us a little bit about that part of the journey.
Yeah, I came from Turkey, immigrated in 1999. I went to undergrad in medical school in Kentucky, and I did my residency in New York, and then somehow ended up in beautiful South Carolina.
That's so great. Well, tell us, I mean, in terms of being a doctor, which I think is one of the most amazing professions, you have a calling to really help people. I mean, you have an oath that you have fought to defend.
I do. I love medicine. I love taking care of people. It's one of the best professions, and I love what I do every day.
Yeah. Well, I can say to you all personally, he looked after me during that crazy time in the COVID era. And what I loved about what you did, Dr. Lachin, is you looked after me genuinely.
Thank you.
You cared for me as a patient before anything else. And I can't say that about every doctor. I really can't. That's why I went to you. I mean, I live down the low country, and I came up here specifically because I knew what you would do.
Well, I opened my own urgent care because I didn't want to work for a hospital. And I truly believe, to this day, I believe doctor-owned practices are the way to go.
Absolutely.
And because the doctor owns the business, takes pride in what they do. They're not just an employee, they're also the business owner. And I think the quality of care goes way higher if you own the practice too.
Yeah. Well, let me ask you a fun question before we get to some of the other things. In terms of all these people you've helped over the years, is there any stories that stand out to you, like you felt so proud that you get to be in the profession you're in?
I catch a lot of cancer and a lot of heart disease. I have one patient came, and her only complaint was she couldn't run on the treadmill more than 10 minutes. And she used to be able to do it for 50 minutes. And that was the only symptom she had. And I had a gut feeling like something is wrong with the heart. I immediately called the cardiologist, and she got to see the cardiologist almost the same day. And she had a 90% blockage. So if she was 90%. A couple of days late, she will be probably dead. So I saved her life. And COVID, we saved a lot of lives because COVID was a very unique situation. Primary care doctors were not seeing the patients. Hospitals were not accepting the patients. So urgent cares were filling that void where our doors were always open, no appointments, just walk in and get the help you need. And during COVID, we were the main frontline clinics. So we filled that void greatly. Yeah. I mean, I didn't go home for 2 years. I worked 7 days a week for 2 years straight. So, working 700 days without a day off, it was a challenge. Yeah. And we overcame, so we are here now.
Why? Let me ask you a big question. The why question is the most important question. Why did you decide to put the patients first and not do what a lot of other practices did, which was fearfully make decisions but not honor the patient's request? Because that's what made me stand out about you was you really did put the patients first.
I did, because if you don't, who else will? The hospitals failed us, and as a doctor-owned practice, I were able to make executive decisions without have to listen to the higher-ups.
Right. Yeah.
So we have to break the protocol. We broke the protocol. We have to change the rules on the fly, and we did it. And we have to adapt very fast. So that was the advantage we had. I was doing COVID testing and treatments. hospitals were sending me patients because they ran out of tests. And as a private clinic, I could send my manager to Atlanta or Georgia or some other state to find and procure tests. Like, it was hard to come by. So we were able to treat 180, 200 patients a day sometimes. So it was massive number of patients. So we take pride in what we did that during the pandemic.
When you think of the word freedom, which is a very important word, the Irish fought 800 years to get our freedom from the British. All over the world, people have put their lives on the line to get that freedom. What does freedom mean to you, Dr. Lachin, when it comes to the medical world? Because I think it's such an important
freedom
word.
Is everything. Money is important because it gives you freedom. Health is important because it gives you freedom. United States, the whole world tried to immigrate here. You immigrated, I immigrated to this country, and in the basis, it's not for career, it's not for education only, it was mainly for freedoms. And our countries didn't give us what the freedom we define, and we found it in this country. So freedom is the American system, the American dream is the freedom.
Yeah. And in terms of the medical world, so when I ask people, hey, have you held your oath? What does that look like in the last 5 years, holding to your oath as a physician?
Holding your oath is a very difficult task in today's environment because you have to always side by the patient, and that means facing the whole world, the regulators, the government, and insurance companies, pharmaceutical companies. Everybody try to exploit the patient, and you have to be the biggest defender of the patient against these forces and guide them through what is false and what's true and the influences of these giant corporations. I think that's our part. We are their public defenders in the healthcare field.
Well, we were talking before we started doing this podcast, and really, in my opinion, this is just my own heartfelt opinion, it's not really the political parties that's the real war. It's regular people against the elite.
Yeah, there's no left and right in this one. It's everybody. It's when your health is involved and your loved ones are involved, health of your loved ones, nothing matters. Politics doesn't matter.
Right.
You just want to live, and you want your loved ones to live a good life and healthy life. Health is beyond politics. There's no only political party I believe in is health and equality and freedom.
Absolutely. What would you say has been the hardest struggle for you, keeping that oath in the last couple of years and doing right by the patients?
I will say pharmaceutical companies and fighting with insurance companies. I think the most difficult part of my job is my struggle with insurance companies to help get patients paid for the services they get and dealing with the insurance companies, because I think they are the enemies of the humans, enemies of the patients, the insurance companies.
Yeah. Well, I was telling you before this, I haven't met one person who said, oh, I love Blue Cross Blue Shield. Not one.
I hate them with a passion. I don't like them. I think they are an evil corporation. And I will explain you why, beyond the adjectives, how they do certain things and how they manipulate the patients and how they manipulate the system. When I opened my clinic, one of the main obstacles was even getting a contract with Blue Cross Blue Shield. And everybody say, why you need a contract with Blue Cross Blue Shield? Because in the state of South Carolina, Blue Cross Blue Shield is the dominant insurance company. They are a monopoly. They control the state employees, federal employees. They have their hands on Medicare and Medicaid. And they are about 70 to 80% of the commercial market. So if you have a clinic and you don't have a contract with Blue Cross Blue Shield, you cannot survive. And they know that. They are very well aware of it, and they use it to the maximum to extract things from you and destroy you. Yeah.
Well, my thing is, and you know this very well, I'm all about promoting small business owners. Again, the corporations have taken enough of our money, right? Absolutely. And what about the veteran-run, family-owned businesses? In the same way, when you're going to barely able to get an x-ray done or get some kind of procedure done, and these people are struggling just to get it done. And these people are doing so well, right, with their private jets and their lavish lifestyles.
Absolutely. And Blue Cross Blue Shield has 2 private jets in the airport. They pay their executives in the millions of dollars. They have billions in reserves. They have plenty of money. And and they are living a very, very luxurious life and at the expense of the patients. Your premium dollars fund their luxurious lifestyles.
Oh, gosh. I mean, that makes me sick to my stomach, to be honest with you.
Absolutely. You know, when I opened my clinic, my first obstacle was getting a contract with Blue Cross Blue Shield. I went to their office as a doctor, which is an embarrassing situation, going to a headquarters of Blue Cross Blue Shield and begging them for just a contract. I went to him and I begged him. I'm not going to give the name of the person, but he will know when he's watching this. He refused to give me a contract. And I asked him, why you will not give me a contract? I want to open a clinic. I want to serve the patients. And they say, we don't want you. We don't need you. We don't want to give you a contract. So you are literally at the mercy of one person in a corporation just to practice what you trained for 15 years. I have a building. I have a business. I have employees I hired. I invested all my life savings. I have the education to treat the patients. And this one person says, I don't think you should practice. I don't think you deserve a contract from Blue Cross Blue Shield. So right there and then, they can kill your business at its infancy by just denying you a contract.
I mean, what really just baffles the mind, in my opinion, is who wouldn't want to help doctors, right? Yeah. I mean, talk about, like you said earlier, it's just basic humanity.
Yes.
We all are flesh and blood. And the fact that an insurance company wouldn't say, hey, whatever I can do to help you get out there and serve people.
That's what you would think, but that's not what they have in their mind. I mean, even before I opened my urgent care, I used to work for a group called Medcare Urgent Care. Mm-hmm. They had arbitrarily one time, they just took them out of the network. Blue Cross Blue should say one day, well, we kick you out of our network and we don't want you to see our patients. And that was devastating to that business. They did it to another urgent care group and a couple of other urgent care groups, and a couple of them went bankrupt. So Blue Cross Blue Shield used their market power to bankrupt urgent care clinics before even I opened my doors. So they had already a history before leading up to my clinic. So I already knew their evil ways, but I got to experience them firsthand when I opened my own urgent care clinic.
Explain for people that might say, well, okay, this sounds like a doctor insurance battle. For the regular average person, when they're going into the hospital to get these procedures done versus going into a private care, explain for them like why it's so important that we do balance this unbalanced system, because for them it's hurting them more.
Absolutely.
The way that it is.
So here's the thing. If you go buy a gallon of gas in a gas station, right, you expect the price to be pretty much the same everywhere, right? Maybe a couple cents here and there, or you want to buy a piece of bread or milk or anything. There's an approximate price for everything, right? Healthcare is this one weird thing that you go to one clinic, pay $1, and you go to another clinic, you pay 3 times more for the exact same thing.
Exactly. Yeah.
And that's why it comes to play. That's my struggle is. Blue Cross Blue Shield is not just my biggest payer, is also the owner of my biggest competitor. That's a very unique place. Doctors Care is the biggest urgent care clinic in the state of South Carolina. They have 52 clinics. And for more than a decade, they were owned by Blue Cross Blue Shield. So the person who pays me also owns my competitor. And that's a very big conflict of interest. And that's unacceptable. And then put on top of that you get paid different rates. I'll give you an example. And like, for example, if you come to my clinic and you're coughing, so, right, one of the first things I will do, most likely, do a chest x-ray. So if you come to my clinic, I will get paid $31 for the x-ray.
Okay.
If you walk down the street, go to Doctor's Care, which is were owned by Blue Cross Blue Shield, they get paid $71 for the exact same x-ray. You go to Prisma Urgent Care, $75. You go Lexington Medical Center, $100. So why a privately owned clinic, doctor-owned clinic, gets paid 30 cents on the dollar for the exact same service? And the blood work, you know, if I do a CBC, which is a very basic blood work, $8 to my clinic and $28 to Doctor's Care, or even more to hospital-owned clinics. So this price differential is shocking. Yes. And it is so unfair. And it's sometimes they pay way below the cost of providing a service. So the more you do for the patient, you actually lose money.
Unbelievable.
Which is which creates this environment that the clinics like me is pushed towards bankruptcy.
Yeah.
And, you know, I had 3 clinics and I had to shut down one of them because I couldn't sustain it. and they just put you on a life support. So they just pay you enough so you can survive as a provider owner because you work in the clinic all the time, so you don't have to pay a doctor. But if you become a business and you want to expand and you want to serve more people, and it's become impossible. I get a lot of requests. People ask me, why you don't open urgent care in Newberry or a small town in South Carolina, or you asked me to open one in Murray's Inlet, I believe. And I tell them it's impossible. Blue Cross Blue Shield will not pay me fair market rates for me to open another clinic. And I cannot survive getting paid less than what I cost me to provide the service. No business can survive.
You have to like double the clients to even make up for what you're
losing. I need to see 80 patients to justify my existence, and they can survive on 30 patients. I mean,
you're working 7 days a week.
I work 7 days a week. I don't go home. I don't get to see my kids, and I can barely survive. And it shouldn't be that way. And my business is not struggling. I'm seeing a lot of patients. I have people waiting at the door to see me. So a clinic like that actually not making money to actually pay their payroll, that's a sad situation.
It is, yeah.
And this is by design. This is intentional. Blue Cross Blue Shield of South Carolina do that to every doctor-owned practice pretty much. That's why you don't see small clinics, mom and pop joints.
You really don't.
Towns.
I was telling you before, I haven't seen much, no.
Yeah, if you pay attention, why you don't have doctor-owned clinics or private offices or urgent cares in small towns in South Carolina? Because it's impossible. Without a government subsidy, which doesn't exist, you cannot survive. Blue Cross Blue Shield makes it impossible for you to survive, and that's an evil design by the company insiders to change the landscape, the healthcare landscape of the entire state.
Well, and to me, that's the opposite of medical freedom. I mean, when you think about all the complexities there are when someone comes in to get treated and they know their body and their family does, when you're at the mercy of just a hospital, and you have no other choices, which is what's happening, because like you said, they're bankrupt and all these people. I mean, if there's ever a political issue to fight on, this would be it.
It is. It is our life.
What else do you have but your life? So for folks to say, oh, I don't know about that, well, you need to know about it.
You need to, the more know about it, know how they play the game, you can fight them in their game.
Absolutely.
And that's what I'm doing right now. My job is to educate people how this game is played. I want to educate people how Blue Cross Blue Shield kills privately owned clinics, so we know how to solve the problem. Yeah. If we can identify the problem, we cannot solve the problem.
Exactly.
And if you look at the price structure, if they come public, they become transparent, they publish every single clinic and how much they pay, the price list, you will be in shock. And I want people to know this. This information is out there, they're hiding it behind walls, but my job is to put it out there, see how much our clinic's getting paid and how other clinics are getting paid, and you will be enraged. You will be very, very mad when you see the price list.
Well, that's why I've said a lot of people your way, and they've said, "Wow, he really is a doctor of the people," you know. And people are that's what they want, Dr. Lachin. They just want transparent. They just want fair. They're not looking for anything special for them. They just want to know that they're going to get a decent price for the procedure and not be bankrupt as a family, because think about how much families have gone through the last 5 years. So what you're doing is fighting for them.
Yeah, and this is not just urgent care or primary care. These are specialties too. Like, I'll give you an example. You come to my clinic, you have chest pain, right?
Right.
If I send you a hospital, it might take months, weeks to get in with a doctor, right? But I can call my buddy who owns his own cardiology practice, that he's the doctor operator. I can send you there same day or next day. I just send him a text message, hey, I'm sending this patient, take care of him. And he will see that patient same day sometimes. And that's an incredible service. That's the way it should be. But that guy who owns the cardiology practice, that doctor, he's getting paid 30 cents on the dollar. So why he's providing better, more timely, more personalized service, and for the exact same CPT code and exact same procedure, he gets paid 30 cents on the dollar. He can do an echocardiogram in his office and he will get paid 30 cents. And same echocardiogram in a clinic with the hospital's name on it is $2. How does it make sense? Why you pay so much more, and why you betray the doctor-owned practices like that? Yeah. We need to answer that question first.
Well, I have a big question for you. Why hasn't this been challenged before?
So Blue Cross Blue Shield of South Carolina is one of the biggest employers in the state. They have immense political power. They pay lobbyists. Their foundation donates money to a bunch of charities, so a lot of people's benefit from that. They cannot directly pay political candidates, but they will fund their pet projects. So a lot of people are indebted to Blue Cross Blue Shield that way. So immense lobbying power. They spend a lot of money in different ways to influence our politicians. So they're untouchable. Only entity that will regulate Blue Cross Blue Shield of South Carolina is Department of Insurance, and they're not doing anything. They will not investigate, and they will not provide any oversight to Blue Cross Blue Shield of South Carolina.
Well, that begs the question, why? Why won't they?
Because that will cost them in their career. I'm pretty sure Blue Cross Blue Shield is so much power, can destroy people. I mean, they can destroy me, and I'm not afraid. So that's the only difference.
You stood up before.
I stood up.
Fighter right here.
I'm a fighter. I'm not afraid. One thing about me, I'm not afraid. I will speak to the power, and I'm not afraid of anybody except God. And I'm not gonna be scared of some big corporation, and they can call me with their lawyers, which they already did. They can try to intimidate me with calling the police on me or destroying my contract or pulling my contract. I'm not afraid of them. They're just humans like us. Actually, that's the next thing I want to talk about, actually, what Blue Cross Blue Shield of South Carolina is. I think a lot of people don't know about the entity.
Oh, don't know.
A lot of people think it's a private company. And Blue Cross Blue Shield is not a private company.
Yeah, I thought the same thing.
Yeah, it's not a corporation, like in a sense that it's not publicly traded. You cannot buy its stock. It's not privately owned. It's not like owned by a private equity, or it's not owned by one person. It's actually what we call a mutual insurance company. Mutual insurance company means it's owned by the policyholders. And believe it or not, I'm a policyholder. Actually, I provide Blue Cross Blue Shield policy to my employees. So directly, I'm actually part owner of Blue Cross Blue Shield if you talk about the legality of it, the technicality of it. So it's a mutual insurance company. That means every year, policyholders show up in the meeting in April, third week of April, and can vote for the directors of Blue Cross Blue Shield. And last 7 years, it never happened.
Never happened.
Never. A few people probably show up. They send you a letter and they say, you can come, but if you don't come, you can just sign your signature proxy and elect these candidates we already pre-selected for you.
It may seem so unimportant. Just don't worry about it.
It's like a lot of people throw it to the trash. They don't pay attention. They think their voice doesn't
it's
matter.
So important.
And it is a rigged system. I tell you how it's a rigged system, because when you get that piece of paper, the candidate's name is probably already on it. So you kind of choose, you either don't vote, and if you do vote, proxy vote, you have to pick pre-selected candidates that's approved and filtered by the insiders of the Blue Cross Blue Shield. So this is a system that's built in a way that you will never get an outside, independent, outspoken director on the board. It will be always this small clique of people. They self-select. And that's a very perverse way of doing it. It's not the law meant to be. I think it's illegal. And when people see how the process works, you'll be wake up. This is not democracy. Yeah. This is
no, it's the opposite.
It's a very rigged
there's
system.
No transparency, and it seems like you can't question, except now you're beginning to finally question. How long did it take you to figure this out?
It took me 6 years. To be honest with you, I just found out all this because I have my struggles with Blue Cross Blue Shield, and I found out I was getting paid 30 cents on the dollar by my nearest competitor, which is unacceptable. I started looking into Blue Cross Blue Shield because I wanted to, it started with me just wanted to reach out to the directors of the company. I wanted to send a letter to Blue Cross Blue Shield directors because I couldn't talk with the executives. They were not willing to listen. So I was like, okay, what's the next step? Okay, there are people who provide oversight to the executives, which is the board of directors, right? Mm-hmm. So let me write a letter to the directors of the company, right? That's very simple.
Yeah.
Well, it was not simple. I tell you something very, very strange. And Eric, I want you to, I still very amused by this. Blue Cross Blue Shield is an umbrella organization based in Chicago. So they have like 30 licensees. So they're active in 30 states. And in every single state, I can go and find who are their directors are with few clicks. I can go to their website, click, and the board of directors comes down. I can identify who are the people running the company. And I can also find the annual policy holder meeting that they get together and how they decide, how they pick. It's very transparent. In South Carolina, this information is inaccessible. To this day, I couldn't find who are the directors of Blue Cross Blue Shield. I talked to the people, insiders, I couldn't get to the names. I even have a conversation with their chief lawyer, Blue Cross Blue Shield's chief counsel, and she told me she's not gonna give me the names of the directors. And I told her, I'm a policyholder. I want to know who's the directors of the. Yeah. I have a right to know who's the directors. And she told me that she has no legal obligation to tell me who they are, and there's a private information, and I should not have access to it. I found that very, very bizarre.
Yeah.
Like, who are these directors who are getting paid a lot of money to run this company that's affecting everybody in South Carolina? So why the directors are hidden? Why their public cannot know who they are and how much they're getting paid? We have a glimpse from an article from 15 years ago. I think they're getting paid $160,000 back then. Mm-hmm. This is like 15 years ago. God knows how much they're getting paid right now.
You'd almost think a freedom of information request would be.
You cannot get it. They feel like they don't have any obligation to give it to you. And I don't know how they even get elected. They don't mention it. They say in the end of March, they're going to mail me some piece of information and the procedure of how to elect the directors and who are the current directors will be on that piece of paper, but they're not going to tell me, and I should wait until I receive that in the mail to know who they are. So if they don't send me that mail, I guess I'm at their mercy to know who's the... And I want people to pay attention. I want people to know these people are hiding and this system is corrupt. And I want you to see the methods used to elect these directors. And when you understand how the system works, how it's rigged, you will understand that we will never have an independent director and we will never have a change. The few insiders, the CEO, the chairman of the board, Ed Seller, he will control the entire company without any outside interference.
That's the name to know right there.
Ed Seller is number one person in the entire state. If you have family members in state of South Carolina in small towns who cannot access doctors, there are no doctors available to see your dying mom and dad, Ed Seller is the reason you cannot get that doctor. He built an evil empire, and that evil empire affects everybody's lives every single day. Single-handedly, over the last 40 years, he has Blue Cross Blue Shield in an iron grip, and he controls everything. Even if he's 80-some years old, he still controls the board of directors. He's the chairman. And he is involved in every single subsidiary of Blue Cross Blue Shield. Like the one other entity we need to pay attention is the Blue Cross Blue Shield Foundation. He's the chairman of that foundation. That foundation have $300+ million in the bank.
Oh my goodness! Wow.
And every year they give out $15 million to pet projects that he decides which ones they get the money. So, he has a lot of money to give that belongs to the policyholders. That's our money. It's not his money.
I was about to ask, as a policyholder, have you tried to get in touch with him?
You cannot reach these people. They don't respond to you. I'm going to try to reach out to Ed Sellers. Mm-hmm. I hope he retires and leaves the state. Yeah. And I hope he leaves this beautiful state alone and we can get the doctors we need without him.
Well, you think about all the issues that we fight over in our country, and you think of an issue like this, and I'll just say I didn't know about this. I had no idea that this was this disparity, right? But when people awake to this stuff, you don't unsee it. And I think there's two roads you go. You either act upon the injustice and you fight to do what we're talking about, or you just roll over and let the tyranny go on. And we refuse to do that, me and you.
We are not.
So what can people do? That's my big question. What can people do?
Very easy. In the third week of April 16th, at 11 a.m., and I hope they don't change the date and the location.
April 16th, 11 a.m.
They might change it. They will play tricks, but hopefully they don't. That's the date in my policy. That
We'll update
says,
it if we need to.
Yeah, we will update it if we need to. Come to the headquarters of Blue Cross Blue Shield on I-20 on Alpine Road and just show up. If you have a Blue Cross Blue Shield policy, please show up and vote. Your vote matters. Your voice matters. Your presence matters. When you don't show up, these people do anything they want. They run the show. They count on we not showing up. So by showing up, we disrupt the cycle. We break the cycle that they're counting on, and we can make a difference.
Absolutely.
Finally, we can make a difference. Just 1 hour of your life on that special day. Please, please, please show up. And that way, we can get fair insurance policies, fair rates, fair premiums, and access to doctors we love and we want. Yeah. We need to break the cycle. We need to take control of the company that belongs to us. Blue Cross Blue Shield belongs to the policyholders, the South Carolinians who pay the premiums. It doesn't belong into a handful of people who uses those private jets to go exotic locales to entertain themselves. You know, this company doesn't need 2 private jets to serve their needs. Not 1, 2.
Yeah. This isn't some platonic political issue. This is people's lives. And I think what really just gets under my craw and just gets my blood boiling is you think of people in small towns, you think of people in the rural areas that don't have the access like other people have in the big cities. Their lives matter just as much as those that are in the big cities and are close to those big hospitals. So what you're saying is let's level the playing field for all Americans. And this cuts across every line. It is cuts,
yeah. I mean, what was I heard somewhere the cost of healthcare for a family of 4, like mom, dad, and 2 children, is $24,000 a year. That's $2,000 a month. That's inaccessible. Many people don't have insurance, and when something bad happens to them, they cannot reach to the doctor they need. They're scared to go to a doctor. They cannot afford it. And premiums are going up and up and up. And then when premium goes up, they say, oh, medical care is getting more expensive. Oh, drugs are getting more expensive. Oh, doctors are getting more expensive. Okay, that's the argument they make, right? If that's true, tell me one thing. Why their reserves, the money in their bank, keep going up also?
Doesn't make any sense. No.
It doesn't make sense. So if Blue Cross Blue Shield is making more money and have more money in the bank in the end of the year, why you raise those premiums? You didn't need it. Now you have a bigger surplus. Yeah. And I'm going to make a statement out there and through the end of our podcast, and this is give you the irony of the place. State of South Carolina, Blue Cross Blue Shield of South Carolina have a bigger reserve than Blue Cross Blue Shield of Texas.
Of Texas?
Texas is a much bigger economy, much bigger space.
20th largest economy in the world.
Yes. So think about how much money Blue Cross Blue Shield of South Carolina is sitting on. It's bigger than Blue Cross Blue Shield of Texas.
Oh, that really does, yeah.
And it's not required by the state of South Carolina. Actually, they have, I think, 10 times the reserves required by the state. So this is not some regulatory necessary reserve they keep in the bank. It's a war chest Ed Seller built at the cost of our premium payers. Mm-hmm. People like me, people like you, we pay every month. We take it from our mouths of our kids, to give it to this company so they can have more money to play with, to do their own thing. Yeah. They don't need that reserve. They don't need that money. And if there is excess capital, by definition, mutual insurance companies should return it back to the premium payers, to the policyholder. The money should be refunded. It shouldn't be used to buy a third jet. Oh. It shouldn't be used to fund the pet project of Ed Sellers. It shouldn't fund this foundation and that fund. It should go back to the people. Mm-hmm. And we should quit playing the charitable organization with other people's money. You know, give the people the money and let them. The biggest charity is giving the money back to the people. Yeah. Let them use it. Let them spend it. Let them buy food. Let them buy what they need for their loved ones. Let them pay the energy bill or electric bill, whatnot, you know. And look at the numbers. Numbers tell you a different story. I think I want to bring attention to the numbers. And if you more understand how this game is played and what Blue Cross Blue Shield is doing in state of South Carolina, you will be very angry. And I want people to learn more, educate themselves, and with education, knowledge will set you free.
Yeah, absolutely. So on the other side of this, if we're able to turn this around, how impactful would this be for people in South Carolina?
If I become a director, maybe I will. Who knows? Maybe we break that cycle that day, and
right here.
we get both elected as directors. I will nominate you too. I will make the playing field equal for all the doctors. The private doctor will get paid same as the hospital, and hospitals should get paid less because they are charging crazy rates.
Crazy rates.
I will make it equal across the board and let the competition be fair.
Which is all we want. I mean, that's all anyone wants.
And as an indirect result of that, you're going to have flourishing of doctor-owned practices. Right. You're going to have all these private practices blossoming in every corner, and people will have access to those. So they don't have to wait days and weeks and months to see a doctor. They don't even know his name. You will know the name of the practice. You will know the name of the doctor. You will be on a first name basis with that doctor, and you will trust the care you get.
That's what every patient wants, really, if you think about it. Like, if you have a very specific situation, you don't want someone guessing. You want someone to really know your situation and have a relationship.
It's that relationship. Yeah. And we go to the old school medicine. You have the small town doctor. The doctor is part of the community. You're going to get more of that situation. So you are not going to go to you are not just a number. You're a person. And
probably a lot of new clinics, right?
Yeah, and then
they won't be bankrupt like we're seeing.
Yeah, they will be bankrupted by Blue Cross Blue Shield. So if they get paid same as the other clinics, we will see more urgent cares than doctors' care. We will see private urgent cares. Doesn't have a corporate name on it. It's just the doctor running the show. And you will see the service will be way better, and you will see, and we will have small clinics flourishing every corner of South Carolina. And you don't have to wait months to see a doctor or drive 2 hours to see a specialist. You will have it in your small town, and I think that's the future, and we can make that difference in the state of South Carolina.
Wouldn't it be amazing for folks who work in insurance and are part of this to say, I take pride in what I do now because I know that I am looking out as well as a doctor for everyday people. I mean, you think about when an institution gets corrupted. Well, if you take that institution back to the way maybe it was when it was founded,
true,
then you suddenly have pride in that. And I think a lot of people would love that. If they're working for Blue Cross Blue Shield or one of these places, that if they know it's going in the right direction, then they're part of the solution. They're not part of the problem.
Absolutely. And we can be solution. We don't lack the money. We have the money to provide healthcare to every state, every person in the state of South Carolina. It's just the allocation of the resources, how we spend that money. It's not about lack of money. It's how money is distributed.
Yes.
And if you distribute it evenly across the board and everybody gets paid same amount for the same CPT code and same service, and the best will win.
And this isn't charity. This is towards merit-based. This is towards people who are working as doctors.
Absolutely. I mean, there is no justification of paying a doctor below the cost.
None.
Like, if you do more for the patient, you actually lose money. I mean, why you put that burden on a clinic or a doctor? Like, I don't understand, like, how you
Don't
can...
you want to incentivize doctors, not disincentivize?
This is exactly disincentivizing it. And when I open my clinic, when I get my first contact with Blue Cross Blue Shield, the executive I talked to told me specifically, like, we are going to give you this, but under one condition, you are not going to open a second branch. And I'm like, why you care if I open a second or a third or a fourth Veritas Urgent Care? And they said, we don't want you to expand and we don't want you to grow. And I was like,
wow.
And that actually struck me hard. I mean, I just came to this realization that these people are actually changing and affecting how businesses are run. It's not a fair capitalistic system. This is a...
And how many people could be helped if you had a second practice?
Huge. I mean, I had one clinic. I had to close it because I was not making enough revenue because of Blue Cross Blue Shield. So I had to close it. So one of my clinic closed. It was actually serving USC students. So college students were going to benefit from that clinic. And I had to close it down because of the very reason we are talking about right now. And numbers don't lie. If you put the numbers in front of the people and I see the fee schedules, people will their job will drop. It's unbelievable. I wish more politicians look at these numbers and they will ask questions. Why you discriminate against doctor-owned practices? And
what reaction are you getting from other doctors and legislators you've talked to?
the doctors are afraid to come forward. They think if they come forward, the Blue Cross Blue Shield will punish them. And I understand, retaliation is a real thing. Not everybody is made from the same fabric. A lot of doctors are scared to come forward. But if the opportunity is given, they will come forward. Legislations don't even know. A lot of politicians I talk to, they don't even know how Blue Cross Blue Shield is structured and what they do. They have no idea. They are kept in the dark. And a lot of them are not doctors or practitioners, so they don't know. I mean, I don't blame them. If nobody shows them the way, they will never know.
It's just amazing to me. I'm just going to speak really frankly. It's just amazing to me that other doctors haven't gone to their local state representative or senator and said, this is crazy. Why am I getting underpaid for doing the same work? Well, why do you think that is? Or has it just been under the radar and just hasn't?
They just don't have the power. I mean, we are doctors. We are busy treating the patients. Yeah. I mean, when I'm locked in the clinic 7 days a week, I don't even have time to go to my family. How I'm going to go to State House and lobby the politicians? I mean, they build it so much that we have to work to survive, that we don't have time, anything to do. We don't have power. We don't have access to the lobbyists. We don't have access to power. I mean, hospitals have all kinds of power. Nikki Haley, before she became a governor, guess who she worked for? Lexington Medical Center. Alan Wilson, the Attorney General, guess who his wife works for? Lexington Medical Center. So, they not just have power, they hire the politicians and their family members. So, the power is very deep. Hospitals and insurance companies have so much power, and they use that power to suppress people like me and privately owned clinics.
Yeah. Here's a big question for you. What could Blue Cross Blue Shield do right now to change all this, like in an instant?
Be transparent with all the fee schedules and give all the doctors the same fee schedule for the same CPT codes. Very easy. I'm going to pay this doctor X, this doctor same money, this doctor same money. So pay everybody the same. No favoritism, no discrimination. Just pay everybody the same across the board and be open about it. And all the problems will be solved. But they will never do that.
They will never do that.
They will never do that. That's against their fabric. That's against their spirit. They did this for 40 years, and that's why we don't have doctors in small towns in South Carolina. This is intentional. I had
wondered this because I drive all over South Carolina.
This is intentional. One person, I keep coming to Ed Seller, designed it that way. He intentionally made the system that way that small towns in South Carolina will not have the doctors that they will need by price discrimination.
Are there folks that you've spoken to at Blue Cross Blue Shield who are taking this seriously at all? Are they? Well,
I'm talking to them. They're threatening me. They're telling me that I'm disparaging their company and that's against my contract with them. And they say that I can lose my contract if I keep speaking. They told me they will involve the law enforcement because they think I'm inciting violence. I don't know. That's kind of strange. Which I never do.
Never.
I don't condone violence, but they threaten me. They think it will work on me, but it doesn't work. They threaten me quite a bit. But, when I get threatened, it has an adverse reaction to me. Like, I actually do the opposite. Like, I get more enraged.
Because it makes you say, well, why are you doing that?
It makes me more angrier. It makes me more aggressive. It makes me more curious, why these people are doing this. And it makes me go more research, and I found out all kinds of stuff about what they do, and they are not happy about it. Since I'm talking to here, I'm in communication with a lot of journalists. I've been approached by Washington Post, New York Times, Wall Street Journal, ProPublica. I'm literally talking to 15, 20 journalists as we are speaking, and they're curious. Going back and forth, I'm providing them documents. I'm informing them what's going on. They're going to start making their own FOIA requests with Department of Insurance. They're getting very curious because they want to know. Because, Blue Cross Blue Shield is already in the spotlight. There's a big antitrust case against Blue Cross Blue Shield. the main association in Chicago. So people are more concerned and more curious about what's going on at the state level also. So I'm getting a lot of national media attention. So it's outside of South Carolina, people looking into South Carolina. Like one thing I told you, like the South Carolina have more bigger reserve than Texas.
Yeah.
You know, people say, why? Why we have more money? You know, we don't have the economy. We don't have the people. Why we have more money? You know, these are all questions get people very curious, you know, smart minds start thinking, you know, and I'm not the only one looking at those numbers right now. And I'm talking to lawyers. I'm talking to antitrust lawyers across the state. I'm talking to journalists.
We need to talk to Curtis Loftus because he's been one of the few good guys in Columbia, our state treasurer. That would be someone.
I talked to some very powerful lawyers in the state and outside of the state. So, you know, this is just the beginning. This podcast is just the beginning of the big fight. We are going to...
Movement of freedom.
Movement of freedom. You know, this is just the beginning. This is just the warning shot.
And of regular people, that's one thing that's why I love this guy, is, you know, we were just regular people who love freedom enough to act upon that.
Absolutely.
We're not big names and we're not looking for political, I don't care about any of that stuff. I just want to do right by regular people and fight for freedom. And that's why we came here.
And you know what's very interesting is insurance is a topic a lot of people are very passionate about. Yeah. Because, you know, when you have a dying parent or grandparent, they need chemotherapy and you get insurance company denying your claim.
Well, you hear about this all the time.
Your loved one cannot get chemo because insurance companies, some administrator thinks your loved one shouldn't get the treatment because it's not medically necessary, and it's probably not a doctor who's saying that.
No.
We deal with that every single day. And people are fed up. And people are like, okay, if you're on a private jet and enjoying your life with my money and my loved one is dying in a hospital corner or cannot even get the treatment they need,
I think it's very wrong.
People take it very personal. And this is not a left or right, or this is not a Republican or Democrat issue. This is a human issue. And everybody's passionate about it. I think the more we expose, the more we talk about it, more and more people are gaining, learning about it. They're joining our movement. They're going to show up.
Well, it's deeper than this other stuff that we talk about because everyone's had that moment where they're in the hospital or they're in the doctor's office and you're really at the mercy of what's going on in that procedure or whatever.
Absolutely.
So when you have that on top of corruption, I mean, that would make anyone's blood boil. It should.
I mean, what they say, deny, and I forgot the name, but like they deny your claim so long that you will probably die waiting for it. And that's the most evil thing. You know, what they say about only 2% of the denials are appealed. So insurance companies deny just because they want to deny. There is no justification or reason. They just want to pushback. They just is a money saving. We are just numbers for them. For them, that cancer treatment, it might be your loved one's life on the line, but for them, it's just another 100,000 they don't want to spend. And you know, people.
Well, let me ask you a question. What else can people do? For example, if people say we're all going to mass leave Blue Cross Blue Shield, we're going to get rid of could we do something like that as well? Or
you can live, but I don't want people to leave. I want people to take control. Why to leave? Blue Cross Blue Shield is not a private company that we should all leave and they lose money. Technically, Blue Cross Blue Shield is owned by the policyholder. So leaving is actually defeats the purpose. I don't want you guys to leave. I just want you to take over the company. So this is not a mass exodus. This should be a takeover. This should be a coup, like a revolution. Like we should take over the company that belongs to us in the first place. We are just claiming what's ours.
Already ours, right?
Already ours. So why should we leave of something that belongs to us? That 1.72 billion, whatever billions of dollars they have in the bank, that belongs to the premium payers. Mm-hmm. It's not some entities. It's not ad sellers' money to spend and ad sellers' money to control. It's our money to control. We just need to show up, get rid of these executives, and take over the company.
Now, in terms of that meeting you talked about in April, are there others? Are there others in different parts of the country?
No, South Carolina is just one location, one place. Okay. Alpine Road on April 16th at 11 a.m. And they're going to be surprised because they are not expecting this many people to show up. And we need to go and choose our own directors. Yeah. We should choose our own. We should not let them rig the system. We should not let them choose who they want to be on that board. We need to choose who we want on the board to be.
Well, I lead a group of, as you know, thousands of regular people and hundreds of business owners that we will definitely be there.
April, we will show up, and they cannot deny us. That's our right, and we will claim what's ours. That day will be the day of
freedom,
medical day of freedom. Day of that we claim our freedom back, and we need to take over the company that had been destroying our state for 70 years. We need to claim.
Well,
it
South
back.
Carolina has a rich history of fighting for freedom and going all the way back to the British Empire.
Absolutely, Civil War, British Revolution.
Yeah, exactly. So we're just following in line with that. And here's one thing I would tell people. This is from my heart. When people get everything is terrible, we are born into this time for such a time as this to stand up for what's right. And we can either be at the footnote of history that we just let things happen and decay and tyranny take over, or you could be part of history that you stood up and you set others free. And that, to me, makes this exciting. That's why when you told me about this, I said, well, what can I do? It wasn't even a question.
They count on our ignorance and our apathy and our lack of action. When we show action and when we do things about it, they cannot stand on the way. It's like a water dam in front of a water. We will just swept it. And I don't think they can stand in front of the masses. I think we can. One person, I don't care how connected he is or how powerful he is and how many legislators or how many people he knows in the government, the law enforcement or the state, I don't care. Nobody, not a single person can stand in front of the people.
We the people.
We the people. And that day we will claim it back. And we are more powerful than we think we are. And we need to get our liberties back. And that's one state. Blue Cross Blue Shield of South Carolina today. Hopefully tomorrow, other corporations,
And other states, right?
Other states, this can be a...
Started here and, a domino effect for freedom, for medical freedom.
Yeah. I mean, they had get away with it for 7 years, and this year we are done. No more. No more. We are done. People are fed up, and we are not going to take this anymore. They are not going to stop us. They cannot stop us.
Absolutely. Well, I would say one of my last thoughts on this is be praying. In the end of the day, this elitism, control over people, that needs to be gone. We need to knock this out. Absolutely. And you showing up and saying, I'm going to come on that day, says a lot about you, and we'll be there, and I can't wait to be there.
Let's make a change. April 16th, 11 a.m. Thank you very much. Nice talking to you.
Appreciate it. Yes, I'm so glad we did this.